Good afternoon. I'm Congressman Tim Huelskamp of Kansas, and I would like to thank each of you for taking part in today's event. I will give an opening. My colleagues will give brief remarks as well, and then we'll take your questions. We are here today because there is yet another piece of evidence as to why Obamacare is bad medicine for America. Passing the bill to find out what's in it is now asking Americans to pass on their private medical records to the government. A few weeks ago, a Kansan was in my office and told me about a proposed rule from HHS. The rule, she said, would require the creation of some sort of database comprised of patient claims information. Of course, this raised a major red flag. We did some more digging, and sure enough, HHS had a rule proposing methods by which it would collect information to calculate risk adjustment. Very little had been said about it in the media, probably the way HHS wanted it to be. The proposed rule was issued July 15, 2011, and when I learned about it, I immediately wrote a column about the rule that appeared on September 23rd. The comment period for the proposed rule was supposed to end September 28th, but one day after the column ran, HHS extended the deadline for another month. In essence, this rule would require insurance companies to submit and disclose raw patient claims data. HHS proposes a couple of ways by which to do this, but no matter which way it happens, this rule would allow some bureaucrat somewhere to obtain information about why and when you saw the doctor. And if you read my column, you will learn more about it. There are major problems here. The first is the real threat to patient privacy. HHS offers no explanation in the rule as to what information will be required or what will be excluded. It expects, quote unquote, that these data will include demographic data, encounter data for items and services provided in conjunction with a risk adjustment covered plan, and prescription drug utilization data. The second problem is this. We have plenty of evidence that the government is ill-suited to handle large amounts of data and keep it secret. We all know of media accounts of cases in which someone charged with protecting confidential information has lost or even taken home a laptop. Even when safeguards have been in place, employees have violated, intentionally or unintentionally, requirements to protect individual disclosure of data. By our count, in the last 8 years alone, some 550 million records have been exposed by state governments, the federal government, or private entities charged with protecting government-owned information. Obviously, this is double the population of our country, which means that many people have fallen victim to more than one breach of their data. HIPAA-covered entities are now required to report data breaches to HHS, and it was reported last month that more than 30,000 data breaches affecting nearly 8 million people have happened since 2009. A database containing this confidential private information is a treasure trove of information. The trillion-dollar healthcare industry would love to get its hands on this one-stop shop of market information. An enterprising bureaucrat, political appointee, or even White House individuals with ulterior motives or an axe to grind could easily use the information to his or her economic or political advantage at the expense of patient privacy. Imagine J. Edgar Hoover in a white lab coat. Today I'm releasing the contents of 2 letters. One is to Secretary Sebelius, asking her to stop the implementation of this database requirement. 40 of my colleagues have joined me in signing this letter, and I would encourage any additional members who are interested to sign on. The other is to our Appropriations Committee, requesting that they defund this database. That letter has the support of 36 of my colleagues and was mailed just this morning. The House must exercise its power of the purse to stop the implementation of this database. Each of you has a copy of these 2 letters. I would now like to invite Congressman Dennis Rehberg, Chairman of the Appropriations Subcommittee, Labor, Health and Human Services, and Education, to offer his comments. Denny?
Thank you, Tim. Well, in light of the trouble we're having with the Postal Service at this time, maybe you should have hand-delivered that letter to me, because I understand it's coming to me. I am Dennis Rehberg. I represent the state of Montana, and I'm the chairman of the Appropriations Subcommittee of Labor, Health and Human Services, and Education. And I want to thank Tim for bringing this issue to our attention. I don't need to remind you of past speakers having made mention of the fact that we needed to pass legislation to find out what's in it. This is one of those cases that we're finding out after the fact, a situation that we think breaches privacy. And I'm glad to work on it. You know, one of the things that any of us that have been involved in public service for a long time know that the public has a right to know. They want open meetings. That's why we have some difficulty with what's going on with the super committee, meeting behind closed doors. And we can go on and on about the secrecy that exists within the bureaucracy and our right to know what are in the legislation as well. But the government doesn't have a right to know our private records, especially as it relates to health care. That is something that is private between our doctors and ourselves. I'll relate a quick story to you that is personal to me. I get my health care services back home in Montana, and occasionally I have a need to go to Bethesda Naval Hospital. On one particular occasion, I went up for my review, an appointment with a doctor up there, and I was met by a young ensign who had my records and took me to the meeting. On the way back, she saw to it that I left the hospital appropriately. Well, about a day and a half later, I get a phone call from the front desk, the greeting desk, the reception desk that's manned by a receptionist that's a volunteer. And I always know when somebody doesn't know me particularly well because they butcher my name. And she said, "Is so-and-so there?" And by the time the staff got to me, I answered the phone. She says, "Well, what am I supposed to do with your medical records?" I said, "Well, what do you mean?" "Well, your file is sitting on the reception desk here at Bethesda, and I don't know what to do with them." And I said, "Who are you?" And she said, "Well, I'm a volunteer greeter." And I said, "Well, that's interesting." I didn't want to say anything about it, so I immediately called the attending physician here at the Capitol and said, "We have a problem. My medical records are sitting on a reception desk at Bethesda Naval Hospital, and would you check into it, find out what's going on?" Well, I got a great letter of apology from Dr. Isold, apologizing for the fact that my medical records were sitting on a desk for about a day and a half. But, you know, not all of the problems that we're talking about today are necessarily bureaucrats that purposely let out information, whether it's a stolen briefcase from a home that has something to do with veterans' benefits, or a missing file, or Wikipedia, or any of the other. They're not always purposeful. Sometimes it's human error. It's accidental. It's not meant to be. And it just is the kind of situation that it's happened to me. It's not a big deal. You know, I don't care, frankly, but a lot of people would. There are things that the public does not necessarily want the government to know. And so it is the public's right to know what's in a bill like PAPACA, but it is not necessarily the government's right to know of the individual privacy of our health care issues. And so, as chairman of the Appropriations Subcommittee, I have language in my bill that suggests that no money can be spent on the enforcement, implementation, creation of a rule or regulation like this until such time as, first of all of the legal matters are dealt with. Is it constitutional to begin with? And wouldn't it be foolish from an appropriation standpoint to be spending a lot of money on something that may never be in place in as simple as 12 months to 15 months to 18 months from now? I'll continue to work with Tim and any of my colleagues who are interested in seeing that this does not move forward. In addition to receiving the letter from my colleagues, which I will take very seriously, I as well have written a letter to Secretary Sebelius asking, what did you know, when did you know, why did you do it, where's your authority? And at this time, I hope to schedule some kind of an appropriations subcommittee oversight hearing on the privacy issue as it relates to the President's health care reform. So thank you for bringing it to my attention. I look forward to working with my colleagues as their representative, as the chairman of the Appropriations Subcommittee.
Thank you, Congressman. Next up, we have Dr. Larry Bucshon, a freshman like myself, a great addition to the House, and appreciate your comments.
Thank you. Thanks, everyone. Thanks, Tim. I'm a cardiovascular and thoracic surgeon for the past 15 years, and I'm a freshman congressman from the 8th District of Indiana. The HHS proposed rule that could lead to the federal government having your personal medical data is something that came to my attention the other day, and is really another striking evidence that the Affordable Care Act is not good for the American people. As a physician, I can tell you that the only person that needs to know your medical information is you and your doctor. This is an example of the Affordable Care Act giving free rein to a non-elected official, Secretary of HHS, to set the law of the land. I have serious security concerns about the management of the data and its potential use to discriminate against our citizens based on their private medical information. And I can tell you from a physician standpoint, dealing with patients, dealing with insurance companies, this is a significant potential risk that could definitely lead to discrimination depending on what medical conditions you may or may not have. This letter that Congressman Huelskamp is releasing demands accountability from the Secretary of HHS. But since I haven't received very much help from HHS since I've been here for 10 months, I'm also going to release a bill along with Congressman Huelskamp that's going to work to prevent the federal government from receiving your private medical information. Again, as a physician, I have serious concerns about security. I don't see why the federal government needs to know this information, and I'll do everything I can to prevent it from happening. Thank you.
Thank you, Congressman. And next up, we have a colleague to the west, Congressman Mike Coffman from Colorado. Appreciate your comments.
Thank you, Congressman Huelskamp, for bringing this issue forward. Again, Congressman Mike Coffman, 6th District of Colorado. This provision in President Obama's new health care law is an extraordinary overreach of federal power that, in my view, will violate the privacy of all insured Americans. I don't believe that the federal government, first of all, can be trusted with such a massive amount of private data on the health status of so many Americans. Unlike a private insurance entity, if they were to accidentally release the information, they would be held liable for it. Not only liable for it, but that the reality is their insured could walk with their, with their feet and leave those policies. There's no such thing in terms of that power in dealing with the federal government and this massive amount of information. With this law, I think as former Speaker Pelosi said it so well, that the only way to really know what's in it is to pass it. And now that we know what's in it, we absolutely know that not only does the law need to be repealed, but certainly this section needs to be modified in terms of the power of the federal government.
Thank you, Congressman. Next up, Congressman Joe Walsh, another outstanding freshman from the state of Illinois. Joe?
Thanks, Tim. Thank you, Tim, and thank you for taking a lead on this. Not to sound redundant, I'll be terribly brief. Joe Walsh from Illinois. What a surreal experience we've been under since we passed Obamacare last year. I don't know that I exaggerate when I say that every single week since we've passed that legislation, we've learned something bad, new and bad about the bill. And typically these have to do with the hidden costs, the hidden fees, the impact on small business, the impact on our health care. And now we learn again with this rule, this HHS rule, that it will impact Americans' right to privacy. Everything my colleagues has said is spot on as to the dangers and the infringements of this rule. I guess my message that I'd add with everything else with this legislation is slow down. Slow down, Secretary Sebelius. And if you can't reconsider implementing this rule, I do believe, I second what Denny said, that it's up to Congress to defund the implementation of this. Exposing Americans' private information to security breaches, to exposure around the country and around the world is just plain wrong. So in addition to everything else we've learned about this legislation, I often put this on your profession. There should be outrage in your profession that we continue to learn dangerous and negative things about this legislation. This is the latest, and I give my colleague from Kansas a lot of credit for bringing this to our attention. Thanks, Tim.
Thank you, Joe. I appreciate your comments as well. I appreciate each of you for joining us and the many others that have signed on. We also want to thank a constituent from Kansas, a Kansan that brought it to attention, actually read the rule to find out what was in it. And so with that, we'll take a few short questions, if there are any. Yes, sir.
Sure. You mentioned disclose claims information and stuff like that. What specifically, what kind of information would be disclosed under this? Because I guess HHS hasn't quite exactly said, but they're using it for risk adjustment. So what is it, the entire medical record, or is it just pieces of it?
Well, we're finding out in part what they indicate with some of the language used in the proposed rule. The key words is raw patient claims data, which is, as we understand, is an undefined term, but as we note in the rule later, we talk about, or she talks about, could include demographic data, will include encounter data, and prescription drug utilization data, what your prescriptions are when you went to the doctor, your demographic data as well. And that's, as far as we know, what's been described, and we're certainly glad the comment period was extended because this is a fairly new revelation based on what we've discovered.
Presumably there wouldn't be personal identification data in these records, right? You'd have a code or something. Are you worried that somehow people will figure out whose data it is? I can't imagine that they're going to have your name on these records, right?
Well, there would be some way to identify who the individual is, because this data has to be collected year to year. It's not a one-time collection. And the data would need to travel with the individual, if the individual moves state to state. And so there will be identifying data to someone to identify who's the individual data, because under the risk adjustment requirements under the President's health care plan, they have to identify an individual risk score, calculate that for each individual American. So it will be on the individual level. It won't be just demographic data. That's a calculation that will be required for each individual American in order to make determinations under that provision of the President's health care plan.
So you're saying that there's going to be a way for people to figure out whose data it is?
We believe so. And if there are not, the data will be collected when you saw the doctor and what the prescription was, in order to make certain that continues forward, that you have that data. You have to determine who the individual is. Whether you say it's individual A, someone somewhere, a bureaucrat will know who individual A is. We see that in recent releases of inadvertent releases of VA data. It was supposedly secure, but certainly folks are really concerned someone can break the security and have access to individual, confidential, private data of Americans. Whether or not it's as secure as we would like it to be, the real question here is most Americans, if not all Kansans I've visited with, do not want Washington to have that data. Yes, sir.
There's a number of health privacy groups out there, EPIC, Center for Democracy and Technology, just to name a couple. Have you consulted with them about this rule, and is this a concern for those groups? Not those two necessarily, but
sure.
Groups.
We've begun the process of trying to contact them, and again, we put the column out there. They extended the comment deadline. We wish HHS would be a little more timely in their update of submitted comments, but we see some of those starting to come in and concerns about the proposed database. And so we haven't had any comments from those specific groups. But you would think if you're concerned about the government having your data of any type, of most concern would be private, confidential healthcare data. You could just think endless of the amounts of data they could have that Americans do not want the government to have. And I'll see if my colleagues have some questions. Doctor?
I want to comment a little bit about why this is such a big deal from a medical standpoint. And I think if you look back historically at what happened, for example, with HIV patients and about how they were initially treated many years ago, based on the fact that that private medical information, once that was released, there were people who lost their jobs. There were people whose kids couldn't go to school because of fear. There were people who could not be insured for the rest of their lives, all based on one piece of medical information that, if it was allowed to become public and not private between themselves and their physician, had a dramatic effect on their lives. Now, I think that situation is an extreme example of how a piece of medical information can be used if it's in the wrong hands. my concern as a physician is where, are we going to get down to the fact that if your cholesterol is at a certain level, that's going to, if that data is out there, that's going to affect your ability to be insured? Is it going to affect, is the federal government going to demand that you do certain things with your health, or they won't insure you? I mean, there's an endless possibilities of violation of privacy that could have very real effects on people. I mean, personally, I don't really care about some things that are fairly benign in my medical history, but I can tell you that talking to patients and talking to families, there are very serious concerns amongst most of our citizens about this type of information being public.
Yeah, you know what? I'm just distrustful of the federal government exploiting the information for other reasons. And I remember in the 2008 campaign when I think President Obama was running, and I think that there was information released about his relative to his passport by an employee. I guess is it the State Department that does the passports? That was sensitive and was not supposed to be revealed. And so, yes, it would be privacy. I mean, confidentiality would be in the law, but there's a human element to it in terms of federal employees having the information and disclosing it inappropriately. And I just think, boy, the power of having this information. And I think that the doctor is so well stated. And you've got people who are undergoing psychiatric treatment that are taking medications. And it's a very sensitive issue, and so now that's going to be, that potentially could be exposed. I mean, I think that there's just I don't think the American people ought to trust the federal government with this amount of private information.
Sure. I guess this program is supposed to monitor the risk of various insurance companies' beneficiary pools, or how risky one group is and how risky another group is. Why would the government need to drill down that far into the data, into the kind of raw encounter and drug and demo data to get that? I mean, is this the only way to do that, or is there, could they use a more kind of broad data set to do that? Why get this detailed?
Well, that would be an excellent question for HHS and the supporters of this bill. And if I recall the discussion not being in Congress, I do not recall any discussion from the outside talking about a database being compiled and maintained. But it would be my understanding that there's an individual risk score calculated for each individual, not at the group level. It's at the individual level. So you need the data down at the individual level in order to calculate the risk score for each individual American in order to determine whether or not they need a tax to pay for that, or a premium, or a subsidy that would for the insurance company that's carrying that. So I believe that's at the individual level, and that's what the rule indicates: raw patient claims data. And again, an undefined term, and that sounds pretty invasive to me. One last question. Any last comments? Thank you.